guys, welcome back again. Another video for you on a really important topic that again I've seen too many times on the different Facebook groups that I'm part of, different forums with different health practitioners. How do you network effectively and build an incredible health practitioner referral network that actually delivers you more clients today? That's the whole point. Of course, there are lots of businesses that don't use this method. They rely on different methods of marketing in order to draw clients in. But for health practitioners, my feeling is that it's incredibly important to have a strong referral network. And that's for three main reasons. Number one, obviously, it ensures a steady supply of clients coming towards your practice. Because if people are pushing people into your practice, obviously that's far more effective than you having to just only speak to them through your other marketing methods, whether that's your website, using different advertisements, either on Facebook or on Google, or even just the traditional ones like flyers and things like that. And so secondly, it reduces your strain on your other marketing methods as well. So you don't have to work as hard. If you've got people who are actually referring other clients in for you, then that's a great thing, right? And then the last thing is that you've got a warm sell there. Think of the last time that somebody recommended a product to you. You're far more likely to have that product if somebody has recommended it to you. And that's a warm sell. A cold one would be if they just saw your advertisement and then decided to come and see you. And a lot of the time, health practitioners focus on the cold sell, but warm sells are much more effective. So, I covered this topic some time ago in my Facebook Live video, and I talked about something called A, B, and C lists. And in my experience, this is one of the most important things that you can do for your health practice in order to enhance the number of people coming directly in to come and see you right now today. So, what are A, B, and C lists? Okay, so if you didn't tune into my last video, shame on you. Why didn't you? Anyway, I'll forgive you. An A, B, and C list is a way of categorizing your current referral network, or the people that you know. A lot of people don't network effectively. What they do is they just go out and meet new people, and that's not networking. Networking has to have a purpose and an aim at the end of it, and each of you, that includes the person that you're meeting, has to get something out of it. It's business at the end of the day. So if you don't have an objective in mind when meeting new people, then you're just meeting new people at the end of the day. And that's fine, that's great, everyone likes to have more friends. But for business purposes, your time is limited, time is money, and you've only got so many hours in the day. So you can only have so many meetings and so many text messages that you can respond to and so many emails that you can reply to. So you've got to make sure that your network is effective and it's working for you. And the A, B, and C method works really well for this. So starting with the C list. What you want to do is to first think of people that you actually need to network with. So actually, if you've not got anybody at the moment at all in your network, then this is actually quite a good place to start from, because you can then start from afresh. If you've already got lots of different, maybe doctors, maybe personal trainers, maybe physiotherapists, maybe other practitioners, psychotherapists, whatever, you've got different people in your network who potentially could refer clients to you, or that you know, you need to put them into each of these different categories. So starting with the C list. The C list are people that you want to connect with. So you don't necessarily know them, maybe you know of them, maybe they're in your local area, maybe they're within your own practice even, you're in your surgery. If you work in a surgery or if you work in a leisure centre or wherever you work, there are other people there who potentially could send clients to you. But these are people that you've not actively spoken to. So it's almost like a to-do list, okay? So keep this part of the list very short. Just have maybe a handful of people to start with. You don't need to meet everyone. It's absolutely fine to revise this list over time. You know, there might be people come and go, people change professions, people have time off, you know, they take maternity leave or paternity leave, you know, and there's going to be changes of paces in the system, so you'll need to revise this list over time. But maybe start with, say, a handful. I'll give you an example. So as a dietitian, it's useful to have a GP to access to, a physiotherapist, gastroenterologist, maybe even a couple of surgeons, maybe somebody else from a different speciality that you know, maybe endocrinology, maybe gynecology, something like that, and a strength and conditioning coach, personal trainer, something like that. And that would be a good start. Now, obviously, you need to make that more specific depending on what speciality you're in or what field or discipline you're in. But now you've got the core list that you can start with. Now, moving on to list B. The B list are people that you've contacted and they've replied to you. All right, so that's the difference. You've started a conversation with these people. They've moved from the C list now to the B list. This is the point where often people now just fall into limbo. They get into this sort of, matrix, or, this whirlwind of doom where they just can't get out of it. They never seem to meet these people, and obviously they don't get any referrals back, but they've obviously made contact with somebody. You now need to actually engage with these people properly. So a lot of the time, again, I hear people giving up at the first hurdle. So they won't even send that email to somebody out there. They won't even make that call. They won't engage with somebody's secretary. They won't call a practice. Not everybody responds to the same thing. For instance, I have lots of different emails from different people, each day. And I categorize them depending on urgency. So sometimes I won't respond to emails for maybe a day, possibly up to 48 hours. Because I've got more urgent things to take care of. And sometimes I've read people on different forums, or people putting things on Facebook, that they've emailed somebody and they've not replied to them. Okay, and so they've given up. Well, that's I'm sorry, but that's kind of not enough, really. If you really want to make contact with this person, you've got to try a few different methods. So perhaps call the surgery, maybe even if they've got a website, go through that method instead. Call their secretary, leave a message, maybe even literally go to their workplace and drop in, just leave a card and just say, I've dropped in, could you pass this to, Dr. Smith, and just let them know that Rick Miller called it. That's the B list section. And the idea is that you're moving the people from the B list to the A list. Now, your A list are people that are your VIPs. These are people who have started to refer to you. They're actually pushing patients in your direction or clients in your direction, and you need to treat them like the very important person that they are. I mean, at the end of the day, they're filling your pockets with the money that you need, okay? So, and again, this is a point where sometimes people get wrapped up in. Treat them well. Take them out for a coffee. It doesn't have to be expensive. If you're an entrepreneur, you're just starting out in private practice, you probably don't have oodles of money, sitting aside for entertainment. But you can definitely send somebody a Christmas card. You can buy somebody a coffee. You can offer to, give them a free consultation, something. But give something back. Remember what I said to you before. There's got to be in it something in it for the other person. If there isn't, why should they send people to you? Of course, everyone wants us to look after their clients, but at the end of the day, they've got a business too. So you've got to make it worth their while. Okay, so you've got to think about that. Make it worth their while. And on that note, I'm going to give you another piece of really, really crucial advice. Give to receive. Now, it sounds almost semi motivational quote or spiritual or whatever category you want to put that into, but it's incredibly important. If you don't give something, why can you expect to receive anything? And again, I see the grievances of different people saying, I've not received anything in my direction, I hardly received any referrals or anybody coming through my door. Maybe you're just not giving enough. It's something to consider. And if you are giving, or you do perceive that you're giving, are you giving the right thing? Is that the thing that person wants? Ask the question to your referrer, how can I help you grow your business? Or how can I help you more with your practice? Or what can I give you that will add value to what you're already doing? And that's a much more important thing to do. And that way you'll grow together and your network will continue to expand and it will flourish. Otherwise it's not particularly useful to you. Okay, so just to summarize, networking is incredibly important as a health practitioner. More importantly, your network can provide you with a steady stream of patients that will just explode your practice tomorrow if you use it effectively. Now, how do you use it effectively? You use A, B, and C lists. The C part of your list should be people that you want to engage with, keep it short, but you haven't actually spoken to them yet. The objective is to get your C people onto the B list. The B list are people that you're communicating with and you've started a dialogue, but perhaps they've not quite started referring to you yet. And you need to use a multitude of different methods in order to get them onto the A list. The A list are your people that are actually referring to you. These are your VIPs. Look after them, treat them well, and ask them that question, that really vital question: what can I do to make your practice grow? And I can help you more. This has been Rick Miller from Health Communication Mastery. Speak to you in another video.